Hi, and welcome to the second episode of Freud and Beyond. So, today I wanted to discuss a paper that I came across when I attended a psychoanalytical reading circle quite recently, actually. And this is Thomas Ogden's work, Ontological Psychoanalysis, or What Do You Want to Be When You Grow Up? It was an interesting read because it really makes you understand just how complex the therapeutic process is, especially for the practitioner as well. And it's in a good sense that I use the word complex here. Ogden's article, I found it to be very important as well because it addresses the question, and this is a question that a lot of us have, is that what is therapy actually? And it tries to go beyond therapy being understood only as interpretations, like interpretations of your unconscious conflicts, desires. It argues that yes, therapy is, it actually shows that therapy is, but it is also something beyond these interpretations. So the title has a reference to D.W. Winnicott as well, and it's in the second line, what do you want to be when you grow up? Because this is a question that he used to pose to the adolescents who were there in the Paddington Green Hospital during the Second World War. While we begin from this question, Ogden actually linked it to the questions that usually patients come up with to therapy. It evolved from what do you want to be when you grow up to what kind of person do you want to become and how can you be that person. So there is a reference to growing up, like a developmental process. And for Ogden, the symptoms of these patients are not simply symptoms, but they are also communicating to us that the patients have put a pause to this growing up process. It isn't always necessarily narcissistic gratification that a patient is being resistant or a patient is being considered difficult. So keeping all of this in mind, we now progress to the therapeutic space itself. And Ogden over here divides his article into two: epistemological psychoanalysis and ontological psychoanalysis. And you can understand this as dividing the technique into two, but using the word technique very loosely over here. Even though they're quite tough sounding terms, they're easily explained because Ogden also cautions us that a therapeutic technique can never have either of these in its pure form. It's usually a mix or one of them predominates, but you don't have them in pure form. Epistemological psychoanalysis refers to knowing and understanding. Over here, we will be talking about interpretation and getting into the unconscious world of the patient. But in ontological psychoanalysis, we are talking about being and becoming. The role of the therapist in ontological psychoanalysis is of being a facilitator, which helps the patient to become themselves more fully. The work of Freud and Klein is dominantly epistemological in nature because they were very focused on getting interpretations and understanding the transference. While the work of Winnicott, we can see it as influencing the notion of ontological psychoanalysis because he talks a lot about the facilitation process, and it also focuses a lot on the arriving process, arriving to an interpretation or to an in-depth understanding, but emphasizing more on how it is that the patient has arrived to that. So I feel that Ogden's article is very important, especially for early career therapists, because there's a lot of confusion about how much should we be focusing on interpretations or how is it that a therapist and a patient are supposed to come to some sort of an understanding, and what actually does it mean when we say that the therapist-patient relationship, the therapeutic alliance, is more important than anything else. So there is a paragraph that I really like and I would like to quote here. Winnicott, almost in passing, in his transitional object paper, uses a phrase that I view as the process underlying successful psychoanalysis and every form of psychic growth. We weave other than me objects into the personal pattern. In other words, we take something that is not yet part of us, for example, an experience with a spouse or listening to a piece of music, and weave it into who we are in a way that makes us more than who we were before we had that experience. So we can see that there's a lot of emphasis on experiencing something, experiencing the therapeutic process, experiencing the patient, or how the patient is experiencing the therapist. So quite an interpersonal outlook that we can see over here, an interpersonal lens, and this is what also something that defines Winnicott's work. And Ogden uses another concept of Winnicott to sort of explain this, and that is playing. And this is what psychotherapy is for Winnicott, the overlap of these two areas of playing, the therapist and the patient. So to understand the concept of play, I am referring to Winnicott's book, Playing and Reality. And the chapter is Playing, a Theoretical Concept, or I think it's termed theoretical statement. When you look at a child who is engaged in play, what stands out is this complete preoccupation that they have with the characters and the storylines. They're absolutely immersed in what they're doing. And this is something which we will term as concentration, something quite close to concentration that we see with adults. What is important is this near withdrawal state that we can find in the child. And I will be very frank, the concept of playing is still quite difficult for me to grasp, because it is something which is not internal, and it's not exactly external as well, but it has its own time and space. So Winnicott also termed it as the potential space, which is present between the mother and the baby, or the cultural experiences in adults. What is very clear is that playing involves the concept of trust, especially when you talk about the potential space between a mother and an infant. We see that the baby has the trust in the mother when the mother has proven herself to be a dependable figure, that he or she, the infant that is, does not exist solely physically in the mother's arm, but is also there in the mother's mind when the two of them are not engaged. So this sense of continuity in us also comes from the potential space and how it develops between the mother and the infant. And this is also the area where playing occurs. It becomes a form of communication in psychotherapy, and it also involves the therapist acting as a mirror to the patient. So in another chapter of his book, Ogden writes about how he talks to this patient, and it's a very beautiful and raw account of it, because he is telling us, almost making us feel what the therapeutic space becomes for him and the other. So what the work does is observe the potential of creative expression, a very creative encounter, because of the fact that our lived realities will be separated, will always remain separated at the end of the day. And when we communicate it to the other, what we are doing is re-experiencing these lived realities. Now, this divide between my lived reality and that of the patient provides us the gap, the potential to actually play. So since there is this impossibility of knowing each other so deeply, so fully, this acts as a reminder for the therapist to give the patient the space to explore their emotions, to pose questions which would rather invite the patient into the space rather than keep them apart as a, like a third person, when you're simply giving interpretations, like simply acting on the patient. But Ogden's ontological psychoanalysis, the facilitation process, it is emphasizing more on bringing in the patient in an interpersonal relationship. So Ogden has two ideas to offer to us. First, that there is no proper analytical technique, in the sense that an analytical technique is a personal creation to a large extent and does not solely depend on the school from which it came out. The usefulness of not always explaining but also describing. This helps both the therapist and the patient to actually engage in the moment and to go beyond simply their wish to understand what is happening. So the fear of how and what in talking with the patients is actually quite universal, and especially so more for early career therapy. But through the works of Ogden and Winnicott, we can actually see this opening up of a space which is more playful in analysis, which is bringing in both the patient and the therapist, which is looking beyond interpretations and actually looks at the role of the therapist as a facilitator. That's it for today, and thank you so much for watching. If you like the video, please like and subscribe. If there are any questions that you have, or if there is any discussion that you want to start, the comment section is open, and see you in the next video.